Hi, this is Dr. Emma Offord, host of This Voice is Mine, the Unquiet podcast. For every neurodivergent mind that was masked, misread or missed, where identity is reclaimed and the system gets named, This Voice is Mine is a podcast for those who were told they were too much, too sensitive, too chaotic, too intense or not enough. Hosted by myself, Dr. Emma Offord, a clinical psychologist, neurodivergent woman and unapologetic system disruptor. This podcast explores what happens when difference is pathologized and what becomes possible when we drop the shame, the script and the medical model. Through stories, reflections and conversations with people who were never meant to fit, This Voice is Mine reclaims the truth of neurodivergent minds, bodies and ways of being. This is not about fixing or fitting in. It's about remembering who we are and unlearning everything they got wrong. Today's guest is Dr. Helen Wall, author of Menopause and ADHD, and someone helping to bring urgently needed attention to a group of women who've been overlooked for far too long. Helen writes and speaks about the intersection of ADHD, hormones, and women's health, particularly what happens when menopause strips away the coping strategies and masks that many women have relied on for decades. Her work challenges a medical system that was never really built around female presentations, fluctuating hormones, or the complexity of neurodivergent lives. She also brings both professional and personal insight. As a clinician, a mother to an ADHD daughter, and an advocate who is not afraid to name the anger many women feel after years of being dismissed, misdiagnosed, or simply missed. This conversation matters because it asks difficult questions about who gets seen, who gets believed, and what happens when systems fail women. Helen, welcome to the podcast. We're so delighted to have you here. For some of our listeners who maybe they don't know you yet, would you mind telling us a little bit about who you are and what you do?
Yeah, so I'm Helen Wall. I'm a GP by trade. I've been a GP in the north of England for 18 years now in the same practice. A doctor in the NHS for more than that. And I am a menopause specialist, registered with the British Menopause Society. I also do a little bit of private clinic work, mainly menopause, but it can vary. And yeah, I'm a mum of 3, and yeah, just generally winging life, really, as a perimenopausal woman.
Yeah. So yes, you're also an author, aren't you?
Yeah, I always forget about that bit.
Yeah.
Yeah. I am now an author. Yeah. Menopause and ADHD came out in May with Penguin. And yeah, it's just been a roller coaster since then, really.
Well, I noticed you coming onto Instagram. We were already there, and you just exploded on Instagram, and I'm not surprised because there are a lot of people who are menopausal and ADHD. It's a great topic.
Yeah, it wasn't planned really. I did a lot of work in COVID for the COVID vaccine in Bolton, where I was based, because part of my role every week was doing some CCG work, which is like the health board work. I was clinical director there. And through that I got into some media work and did BBC Breakfast and Morning Live, and then I got a weekly women's magazine column, which I still do. And then things just sort of transpired, don't they? I started to do my menopause clinic, and I started to see women that I was recognising things were a bit more catastrophic than perhaps regular perimenopause, menopause. I'd had my own perimenopause struggles just before that. Struggled to access HRT, but felt like my brain completely shut down, I couldn't function. So I could cope with the night sweats, I could cope with the hot sweats, could cope with the aches and pains, palpitations, but the one thing that was really stopping me functioning was my brain not being able to work. I was working, but it was hard. I was having to put a lot of effort in and getting quite distressed with it. And running alongside that, all these things were sort of happening. My daughter, who's now 18 next month, she was diagnosed with ADHD, and I'd recognised that the hormones in puberty had sort of made her so much more florid in her symptoms. So between all of that, I started to piece together there must be something going on here where our hormones as women are affecting our brains. And it feels really, I'm a bit embarrassed to say it, but I'd never really thought about that before. Like, as a doctor of many years, I was never taught in medical school that your estrogen and progesterone could affect your brain. I was never taught in GP training or any of my doctor hospital jobs that I did. And I started having to do my own sort of reading, because you go down a bit of a rabbit hole, don't you, when you've got loved ones affected.
Absolutely.
And you're going through some things yourself and you're seeing patients with it. It's like going down this rabbit hole. And the reason I'd started my Instagram was because I was doing all these bits of like TV and magazine stuff just like on the side as a bit of a hobby, really. And they kept saying to me, you know, what's your handle? And I was like, oh, I don't even know what my handle. Well, my handle is, I think it's great, you know. And my daughter was like, Mum, they mean your social media handle, like you need a social media. So I started my Instagram really just for that, just to keep those bits of work going that I enjoyed. That was like my creative side.
Mm-hmm.
And then one day I just came home from a clinic having seen like all these things were going through my head. I was doing a lot of reading about it, and I just put a post on Instagram about it and said, you know, I think our hormones affect our brain and worse than ADHD. Has anyone noticed this?
Yeah.
And oh my gosh, like it just blew up.
Yeah.
Like, and since then, it's just gone from like, it's just gone mental. And so many women contact me on like so many, that every single day I get messages from women. Obviously I can't give personal medical advice, but just women distressed really saying, you know, I don't know what to do. I don't know, my GP isn't sure what to do. I can't. And something that's really strange that's happened. I don't know if it's strange, but it shocked me.
Mm-hmm.
The book is written for the woman, so to sort of answer all those questions that I get in my inbox every day, the things that I post on social media to try and help women, the patients that I see. But colleagues and GPs and healthcare professionals started messaging me saying we're going to read it, and you know, we never knew this was a thing. We never knew the impact that hormones could have. Had a gynecologist put on one of my Instagram reels. I'm a gynecologist, and this is all news to me.
Yeah.
Because I was going to ask Helen, like, because obviously when you was talking just then, my thought is, how's this going to go out? Because this is not, like you said, it's not well known. And how do we get this out there now? Because if you're receiving that amount of messages, we know through our work, also through our own experiences, that this is just not out there. And there are millions of women who are fighting this alone.
Yeah.
And have you thought about like what's the kind of next steps for this?
Yeah, no, I've thought about nothing else really since my book came out, because like I say, it kind of sideswiped me. I was expecting the book to be helpful to some women who were struggling. What I didn't expect was sort of the massive response really of, oh my God, like this is a thing. And so I've kind of started a bit of a mission. Trying.
Good for you.
Yes.
because then what happened
We'll join
was, then what happened was I wasn't going to do a book launch. Got massive imposter syndrome. I was like, no one will turn up. Like, I'm not going to do a book launch. It's just like let the book come out and I'll just see how it goes. And about 2 weeks before, people were saying, come on, it's your first book, you've got to. So I set up a little book launch in a loveliest little bookshop near where I live in the northwest, and the lady that owned the bookshop said, oh, I've done loads of these events, we'll sell tickets and we'll invite people to come. And I said, I don't think anybody will come. She said, no, they will. Anyway, 30 women from all over the country turned up. Like the women, they travelled 4 hours, 5 hours to come to this like 2-hour event. And the emotion in that room, like the amount, everybody was sharing their stories, there was tears, there was hugging, it was so. And my husband came with me. I think he was just totally like, oh my gosh, what the hell. I don't think until that moment he actually understood what I was writing about and the issues I was seeing on repeat in practice and the messages I was getting. And I did another one actually 2 weeks after that, and he said, you don't want me to come with you, do you? I said, no, it's fine. You stay where you are.
I mean, none of that surprises me, because in kind of parallel to that, certainly in my training, we weren't taught about hormones and how that relates to dysregulation, changes in mental health. We weren't even really taught anything about the sensory system. And you know, this was something we discovered through our own menopause, our own deep dive once we realised our neurodivergence as well. And you're right, I struggle to find stuff about the relationship of hormones and our sensory systems and our mental health. You know, there isn't a lot of...
There's not a lot. There's a huge sparsity. That we need more research. I mean, I think women's research is underserved across the board, like for everything, whether we're talking about endometriosis, PMDD, ADHD. It's not what it should be. But there is some stuff out there, and it's just not being talked about.
Yeah.
And one of the things I'm about to do is submit some FOIs, freedom of information requests to some medical schools to see exactly what they are teaching on these topics, because I don't, it's not looking to blame anyone, it's just looking to change things for the better,
support,
really.
Isn't it?
Yeah.
Because I know I'm not alone in this, but I have endometriosis, polycystic ovaries, and had PMDD, and since I was 14, I've been researching this, because you'd go to the doctors and you're just told, oh, it's anxiety, let's get you on these. And they're like, I know it's not, because 2 weeks of the month I'm absolutely fine. 2 weeks I'm not, like I cannot function. And you're just told it's all in your head. It's all in your head, until you kind of almost gaslit every time
believe
you go.
It yourself, don't
you do. You do. And I think in my early 20s, like I was told, you probably know more about this than me, by the doctor. And so that's kind of when I went holistic then, because I'm like, I don't know how to trust you anymore, because I know what you're telling me is not my experience. And we talk to so many women having the same experience, and you feel so completely alone.
Yeah.
Like, what would your advice be for people that are... I mean, I'm a deep diver, so I researched the hell out of everything and tried absolutely everything until I completely understood what my body was doing. But to try and explain that to anybody that doesn't experience the chronic pain, the chronic fatigue, like that you cannot function, it's so hard for people to understand. Oh, it's just period pain, or and you feel so completely alone until you can really trust yourself and think, okay, I'm gonna have to do this on my own, because
absolutely. And I've seen so many women over the years who've felt like that. And I write in my book about a young lady who I'd seen for years, and I'd wanted to help her, but I didn't know. I wasn't armed with the right information or the right tools. I didn't know what to do. I didn't understand what was happening. And therefore women get missed and dismissed and mislabelled and misdiagnosed. And you're right, they just stop feeling like they can trust the medical profession. And I think sometimes what happens when I see women, they've been through so many different medical professionals that they come in almost sort of expecting to be managed or treated like that. And you've almost got to do a bit of work before you even start from zero. You're like starting behind, just to build that trust. I think there's a lot of medical misogyny in medicine. And I know that those words are flung about a lot, but I've seen it so much. And I think we're on the cusp of change. I think the menopause sort of movement, if you like, for want of a better word, has shone a light on women's health, and we're going into other areas, but we're still so far behind. I mean, endometriosis, I think the average time for diagnosis was around about 9 years, 4 months. I went to a conference in March and they said it's gone up to over 10 years. So we're going backwards in some things. Like, why are we going backwards in these things? And, we've always siloed everything as well. So, for example, endometriosis, we've always sort of said, oh, it's like a gynae, it's a women's health issue. It's just sort of your women's bits that are affected. But actually, we know it's a full system.
Absolutely.
You get inflammatory processes throughout your body. It can affect so many different things. You can literally get endometriosis deposits anywhere.
Anywhere.
And we're still not managing women with this in mind. So I think, I'm very passionate about women's health anyway, which was before this sort of all took off. And I think we've just got a lot of work to do to get to a place where women can feel like they are going to be listened to and heard.
And that they're being looked at as well, isn't it? Because, you know, it's like you go in and it's your symptom that's looked at, but then you're not looked at as, you have endometriosis. So actually what you're saying, that fatigue or that anxiety is all part, but it isn't. It's so disconnected, isn't it?
In silos. And I think part of that is because, we've sort of minimised women's issues for a long time. You know, your periods are normal, it's normal to be in pain, it's normal to have heavy periods, etc. I think part of it is the system that we're trying to work in as well. You know, the general practice system is very rushed, it's very demanding, it's very heavy. I work 2 days as a jobbing GP still every week. We get like 10-minute appointments. You know, you can't do a good women's health consultation in 10 minutes. There's just no way. I'm quite knowledgeable in different parts of women's health. I can't do it in 10 minutes. I constantly run late. That's just what, you know, I just accept that I'm going to run late. And I can do that because I've been in the practice so long that the patients know I'm going to run late, and they plan for that, and they know that when they come in the room they'll be listened to and they'll have the time that they need. But it's draining, like, to constantly feel like you're constantly running behind, running late, not doing the best that you can, not getting on top of everything, staying late to finish all the paperwork and bloods because you've run late all day, going in early trying to get ahead of the day. So I do have a lot of sympathy for GPs as well. I think I can see it from both sides of the fence. I think really ideally what we need is like the women's health hubs where we've got actual time to spend, like decent appointments. If you go and see a consultant in an outpatient clinic, they're not going to have 10 minutes. For a new patient, usually they have a good 20-30 minutes, which probably is still quite tight. I do a bit of private work every week, and I just literally, like, when the patient, I get an hour for that first new appointment, and it is just so lovely. And you know, they come in and I just sit down and say, tell me everything. Like, and I'm not stressed. I'm not thinking, there's 4 people waiting.
Absolutely.
The secretary's trying to get in for me to sign 10 prescriptions. There's an emergency going on in the other room. The trainees just messaged me to go and check, it's just having that time to actually sit down with a woman and say, tell me everything. And it's so valuable. And I think
healing, I would imagine, as well.
And some women, sometimes they come and they spend that hour and then they say, well, I'm happy with the treatment I'm on, I don't need anything. It's like, because they just needed to understand, they needed to feel seen, they needed to feel heard. And they needed things explaining to them in a way that was accessible, rather than just feeling like, they're just being glossed over and passed over. And we've all, I think every woman, I think you'd go a long way to find a woman that's not felt like that at some point in their life.
I think when you describe everything that you've described, how there's misogyny within the systems, there's probably quite a lot of skewed research or biased research as well. There's neglect of certain areas and women, and it's no wonder that people are missed. It's no wonder that people are missed. And I'm just thinking about your mission, and I love that, by the way, but also what you were describing about how GPs, other healthcare professionals are contacting you, that this is a bigger issue than even maybe you realised yourself at the beginning.
Yeah, definitely.
And that's quite a mission, isn't it? Because it's not only education, it's changing attitudes, changing systems. It's getting people to believe that this is relevant, necessary and true. And we have similar kind of feelings about the work that we do. But it's, I'm curious about how that is for you, because, we're kind of like warriors on our own sometimes against these big systems, trying to
And it does feel
heard.
like that sometimes. And I've done a lot of PR for my book myself, and I've had a lot of pushback. It's a bit niche, especially before the book came out and before we saw how popular it was to start with. It was a bit niche. It's a niche topic. At times I felt a bit, God, this is not gonna, we're not gonna get anywhere with this. But actually, going to those events where I met those women, getting the messages I get on Instagram and Facebook about how, I had one this morning, a lady's read my book, she's gone to a GP, she's been referred, she just feels so much better just knowing that she's not going mad.
Absolutely.
And that she's got a track to go down, even if it turns out to not be the right track, she feels like she's got some direction. If you've got a mission, you want a room full of ADHD women. Like there is better. There is like no better team behind you than women with ADHD. Because I cannot tell you the amount of passion and drive and energy, creativity. Like I've got women contacting me wanting to do conferences, saying they've written a poem and they want to read the poem. I've got a lady that's wrote me a song that she's now released on Spotify about. It's called "You Are Believed."
Wow!
She's taken words out of the book and written this song. I've had somebody made me a T-shirt with it on, and it's such a powerful, empathic group of women that I just think if anyone can get this word out, then we can.
We can. Yeah.
And just listening to you and describing those responses, those women sound to me like they're being seen, maybe for the first time, especially around that maybe they're neurodivergent or their hormones or their menopause, and the power of that those are emotional, messages back to you, aren't they? To write a song, to write a poem is, exceptional. And, in our work, we've kind of got an idea where we talk about Find Me is like a hashtag that we're thinking about using, because we see so many people, mainly women actually, in our work that haven't been seen. And when we give them the time, and when we see some of the things that are unseen, or when we talk to them about, like, sometimes we'll recommend they go see somebody about the hormones rather than a psychologist or a therapist. It's actually, that's probably more likely what you need. And it changes their life. And so, like sometimes people will say to us, but is it true what you're saying about neurodivergence? Is it true what you're saying about the relationship to hormones and the sensory system? No, there isn't all the evidence that maybe other people need. We have clinical evidence of the people that we see. That is all the evidence I need a lot of the time, because the safety that comes from that for people, and the changes and the return to, like their mental health improves, their relationships improve. It's mind-blowing, actually, the changes that can happen. Do you see that?
Yeah, definitely. And I talk a lot in my book about, not needing to, because I think there's a lot of fixation around getting a diagnosis for ADHD and that being like the fixation point, And even before the book came out, I was writing. I don't even know if this psychiatrist knew I was writing the book or not, but he knew I was doing sort of a lot of stuff on Instagram about ADHD and women. And I was at an event totally unrelated to this, and he said, "Oh, you're doing all this stuff, aren't you, about ADHD and women?" And I said, "Yeah." And he said, "You do realise you're just pushing people into an already clogged up system. Like, we can't cope as it is." And no, I'm not, actually, because because it's not all about getting a diagnosis. It's about finally understanding what's going on. And if that means that to feel fully validated, or to access medication, or to get support at work, you need a diagnosis, then absolutely get a referral, get on the on the pathway, get diagnosed. But I always say to women, don't put your life on pause waiting for that, because where I work, it's 4 years for an adult ADHD assessment. Don't put your life on pause for 4 years. Start, if most of the women I see who think they've got ADHD, I'm pretty sure they've got ADHD. I'm referring them for a tick box. And there's things you can do before you get to that point. So, identify with it, learn about it, learn how your brain's wired, learn how you're working, learn what effects your hormones might have on it. Join support groups if there's local support groups, either online or in person. There's quite a few jumping up now around about. Go to the resources, learn the tools and tips and tools that can help with overwhelm and emotional regulation, nervous system regulation, all of that. Just because you've not got that label of ADHD doesn't mean that you have to just wait for it. And I think that just gives women such a sense of like focus and relief, really, that actually they can just do, there is things you can be doing right now. And you know what? So what if you go 4 years and you don't get a diagnosis of ADHD? If those things have helped you and helped you get your life back on track and feel like you're more in control and understand what's going on, none of that's dangerous.
No, exactly, no. So we always say that, don't we, like to parents as well, when they start looking for their children and they haven't had the diagnosis. We're like, if you're questioning it, the same as you said, do your research, and we'll say start parenting through that lens.
Yeah, absolutely.
Now, so while you're waiting, or whether you do or not, but that's...
But that permission to do that is so powerful, I think, because I think we're sort of conditioned, aren't we, to wait for that. You know, wait for the wait for till we've got that diagnosis, wait till it's on our medical records, wait till we've got that piece of paper that says exactly what's going on for us. But so much of the stuff that can help in this part of life, it isn't dangerous, it isn't medical, it's all stuff that will just, you know, hopefully help you feel better. And I just encourage women to just get on and do it, really. So, sorry to that psychiatrist, but I'm not just trying to plug people into a
absolutely not. And
into a
you know, we would
pathway.
Completely reinforce that as well. You know, we believe that people can just get started, self-identify. We do hear a lot of people say things like, "I need to know." So that conditioning you talk about, I hear that in lots of people. They feel they need the expert, the professional to tell them. And that's also part of the system that we need to change, isn't it? That it is valid to identify. If you find, I think it's a simple equation. If that works for you, use it.
Absolutely,
And I don't think you are the expert of your body. You discover that, Jolene, you know, in the story you were telling earlier about your hormonal journey. I was am a trained clinical psychologist to assess neurodivergence, and I didn't discover my neurodivergence until I was, you know, in my 40s, because how I was taught and how neurodivergence was described to me didn't fit my experience. So you've talked about missed girls, missed women, missed people in neurodivergence, and you know, like in so many different ways, people are constantly missed, and like it still makes me so surprised that, given my training, I missed myself. But of course I did, because the way that you talk about menopause and ADHD wasn't around when I was training. The way that we talk about it wasn't around when I was training. But so many people are still exposed to all of these other maybe myths or maybe stereotypes or ways of assessing, that people are going to continue to be missed or stuck.
Definitely. And I think girls and women become so great at masking. They often don't realise they've been masking until something else tips the balance, which can often be perimenopause or menopause. And the other thing that I commonly see, I'm sure you notice this as well, you know, when women are going through assessments with their children, and then they suddenly have this light bulb moment of, oh, okay,
that sounds like me.
Maybe
you know,
that's me.
Isn't it?
Yeah. So I think it's really easy to just sort of not see things in yourself and just sort of plough through. And I think we come from that generation as well, where it wasn't a thing. You know, we didn't.
You just got on with it, didn't you? And I think that's like we were saying, and kind of you get to perimenopause and all that. Everything you've put in place to have been able to cope, you can't anymore. No. Like it falls down, like it's exhausting, isn't it?
Yeah, and definitely.
That's why I think it's so important, people like yourself who can mirror accurately back to people the experience that they're having, to seeing them, to talking about them in your book and on your Instagram, that there's something there that helps them reconnect to their body, that helps them see something different that they've society has missed. When people talk about Instagram, and I can understand some people's concerns about, you know, whether you're a professional or not, being on Instagram. Actually, that's where so many people go to and can get really good advice, but they can really find themselves. That's often a place to start, isn't it? In this search for information that's
We've got to move
missing.
with the times, haven't we? I was really cautious and really dubious when I set off. You know, I was really sort of, gosh, you know, I'm going to get struck off and I shouldn't be. Like,
I was like that.
And you get so many colleagues as well that are a bit, you know, oh gosh, really? You're doing anything? Okay. And I think it takes time to sort of work through that a bit and feel like, you know, actually I'm not doing anything wrong here. I'm actually providing information that's accurate, evidence-based, as much evidence as we have.
Exactly.
Or, you know, a reflection of my clinical practice. But there's still, I think, a lot of stigma attached to that. I mean, I had a comment on one of my posts last week, and it said, what has the country come to? We've got doctors on social media doing this rubbish. You know, you've just got to take it. Yeah, I mean, underneath that were lots of comments like, this has really helped me, and you know, and you've kind of got to sift through it, but I think there is still that
still
real
there,
sort of stigma
it?
around it.
There definitely is. However, you know, part of the mission is system change. It is about raising a voice that has been quietened. These voices and experiences have been. So a platform like social media, a book, those are the kinds of, you know, in routes to raise
noise.
Exactly, to make some noise. So I've listened to most of your podcasts, I would imagine.
Okay.
I'm a big fan, Helen, and I've had so many things that I've wanted to sort of extend the conversation on, and something that really stood out to me, and I knew this, but I think, you know, when you're listening to someone else talking about it, somehow you process it a little bit differently. And you're explaining on this podcast about rates of suicide are higher in women during menopause. And it just held my attention, and I really felt it, because I feel very well scaffolded in my life and in my training, and I've got friends. Yet, you know, I've had the hardest time psychologically and in terms of dysregulation and physical problems during menopause. So I completely could relate to that. And I think for me, that's part of my mission. And I know it's part of yours, Jolene, as well, because we know and we see behind the scenes just where people can go. And it is, you know, it's representative of that statistic, and not just that statistic. It can be other things that are falling apart in people's lives.
Definitely. I remember having, I had a really lovely senior partner who's now sadly passed, but she, you know, some people just make a huge impact, don't they, on your life and how you practice and how you are. And I always remember that. I remember a lot of things that she said to me, but one of the things she said to me very early on in my training was, you see, being a midlife woman is a bit like walking along a platform with sliding doors, and you never know. You know, you've got sometimes you can just fall through one. You know, and it's like, you never know who's just going to fall through that crack. And she was very, very. She had a lot of wisdom, you know. And at the time, I was probably a bit more naive. I was much younger.
You don't know, like, do you?
What's she talking about? But now I know exactly what she means. You know, it could be any one of us. I don't think having a good job, having a degree, having a nice house, having you know, money, none of that makes a difference. I think all the women, any woman can go to the bottom, you know, to rock bottom. And there's so many things conspiring against us in the system that I think can make it much easier to go there as well.
No,
that's quite powerful, isn't it?
It's really powerful. Something else that I was listening to was you were talking about like a sense of rage, like a really powerful response to all of this, and I also really related to that, because I think going back to that statistic, going back to this sliding doors experience for women, when there's the pushback of your book's too niche, or where's the evidence, or some other kind of system thinking, current system thinking, coming back, we know these experiences behind closed doors in the therapy room and, you know, in the treatment room. And, you know, that does fill me with a lot of rage, a lot of hurt. But it definitely propels me into my fight. And
absolutely. And I think when you've got daughters as well, or any, you know, sisters, daughters, whoever,
Nieces,
nieces, it gives you that fire. You know, I sort of found out my daughter had ADHD around the same time that I was starting to see in these women that they were having this horrific time. And when you speak to them, because people always say to me, well, what's the difference? You know, surely in perimenopause, menopause, you feel like that anyway, so how do you know it's ADHD? When you speak to the women affected, this goes back right through their lives, down to childhood, and they don't really realise often until they start to actually think about it. But there's always sort of things that have gone on for them, or points in time where there's been a bit of a crisis, or they've sort of felt like they've had to struggle to keep up, and things haven't been as easy for them as everybody else. And I just had this moment of, I'm damned if I'm going to let my daughter get to this point.
Yeah.
You know, I'm not doing this anymore. Why should she?
No, I completely agree with you. And then I often hear as well, and this kind of speaks to the perimenopause woman who's maybe going on a HRT, but then also the teenage girl. So as a neurodivergent individual who struggles with change, and then we're feeling changes in our body and we can't explain them, and like how can mums help their daughters is one question, and then also on the other side, like the effects of progesterone on a woman and the mood and say PMDD and all that. How, because that was quite hard to explain as well to your doctor. You just told you have to take it because of the thickening of the lining of the womb, but actually when your mood is changing and you're struggling to cope, and then also then as mums of teenagers and they're struggling to cope with the changes in the body, how, you know.
I think progesterone sensitivity is again another hugely misunderstood or poorly understood issue, really. And I think in part because we've never been taught it, probably because we've not got enough studies on it or research on it. We do know, we have got some info. I think we got sucked into this hype of good and bad progestogens. I'm going to clarify what I mean by progesterone, because I always get attacked for this as well on social media. So progestogen being both synthetic and natural body progesterone, and progesterone theoretically being specifically being the hormone that we release and we make. And there's a whole host of reasons why women respond differently to different progestogens. It can be anything. It can be genetic. It can be the type of receptors that you've got for that. It can be the type of how you break down the progesterone in your brain, how much of the breakdown product you produce, how you react to that breakdown product. So there's a whole host of reasons that we're just never sort of taught about. And then we got sucked into this good and bad progestogen, which I hate. We went through this period of time where we were told as doctors really that, and women bought into this, that to have a synthetic progestogen is really bad because fake things are bad, and to have a body identical natural progesterone is really good because it mirrors your own body, so that's really good, which is on the surface of it really logical. But actually when we think about it, we know that some women don't tolerate their own progesterone that well. Like that's what PMDD is. Like we used to say, PMS, PMD is when you have too much of it, or you lose it too quickly or whatever. But we now know that it's a huge sort of myriad of different ways people react to progesterone. It might be that they react to the breakdown product, allopregnanolone, in a bad way in the brain. It might be that it drops off too quickly, or there's all different mechanisms within that. It's quite complex, and And so it makes sense that if some women don't tolerate their own progesterone each month, why should everybody have natural progesterone?
But who's looking at that
Yeah.
for women? You know,
Yeah.
I don't know what, because I've never heard anybody.
So
say that.
there's a few bits of studies, but they're never very powerful studies. They've never got, you know, huge numbers or sort of any sort of significance to them generally. What we actually end up doing is this trial and error process.
Okay.
So we end up just sort of going, right, okay, so we've tried this one, let's try that one. But I think where it falls down for women, I mean, that's bad enough in itself that we have to do a trial and error process, because it puts women through difficult times. But I think what's probably a little bit worse than that is sometimes women get told, oh, you just can't use you just can't use a progestogen or progesterone because they don't suit you. And you know, sometimes we can't find one that suits a woman. I would say probably 80% of the time I can, whether that's using it vaginally, whether that's using synthetic progestogen, whether it's using body identical for a longer period of time, or because some women react when the progesterone drops off. You know, so there's all different ways that we can tweak this, but it's very nuanced, and it's not in mainstream sort of medical practice for most people, because it's just never been taught in that level of detail. And it's tricky for women to then have to sort of go through that and put themselves through that constant barrage of...
because you're constantly going back, aren't you? And then, so I kind of think, well, where do we go? Where do we go? Because...
So, well, we need the research, and then we need it putting into practice. You know, we need the education. I think right now we could do some better education around progesterone. We do know enough to change a little bit of practice. I think I see a lot of women who've been told they just can't take progestogens, and they might have tried one, you know, in one route, one dose. It's not been tweaked, it's not been changed. So when I start women on any HRT, I always say to them, you know, every woman responds differently to this. You might respond this way, or you might respond that way. We can tweak it, we can change it. Don't give up on it. Be aware, because I think if you go out of the consultation room with expectations set, it's always a better place than go out thinking this is going to be the be all and end all, and then it doesn't work out and you just feel let down again. So try and set women's expectations that it may or may not work out, but if it doesn't work out, not to feel bad about having to come back. We can tweak it, we can sort it. And there are some women who just really cannot get on with any form of progestogen, but I think there's probably a lot more that can if we did it. You know, if we had enough patience and time in it, really.
But I think even just hearing what you've said there, like just that golden nugget of information, and I know there's so much more that you share as well on top of that, but those are things that so many people don't know, do they? Including healthcare professionals as well, and that can change everything, can't it? It can put you at ease to go back. It can help you ask further questions. It can help you research the different options that you might have. But
and it goes back to exactly what you said, Emma, about clinical practice. You know, I've seen so many women now with this that I sort of, again, there's a little bit of research on this. It's not massive, but there's a few papers suggesting that women perhaps with ADHD don't always respond that well to the breakdown product of their own progesterone, which is called allopregnanolone. And allopregnanolone acts on our GABA receptors in our brain, and those are the receptors that are calming and relax you. And for many neurodivergent women, what actually happens in that pathway is, rather than it being calming and relaxing, it makes them quite irritable and angry and agitated. So they have a completely paradoxical effect. So I see a lot of women who've got ADHD who come in and they're on what is effectively the best micronized progesterone, because it's natural and it's body identical and it's got less risk with it and all of that, which I'm not taking any of that away from it. But they just can't take it because they go wild. You know, they feel awful on it. And I've had quite a bit of success at switching them to a synthetic progestogen, because that doesn't go through that same pathway with the allopregnanolone. But it's not common practice. So, and I've sort of done that just by trialing it because of my own reading and research. Well, there is some studies that show that they actually have this paradoxical response. And I think it fits nicely with the fact that a lot of women with ADHD also have PMDD and vice versa.
Yeah.
And we think that quite a few women with PMDD have that reaction to the allopregnolones when their own progesterone goes higher at the end of the cycle. It has that paradoxical effect rather than being calming. So some women might go, I'm really tired when I'm on my period. Just before I start my period, I get really tired, I feel really sedate and really sluggish. Women who have PMDD often get more agitated and irritable, and they just can't, they don't like they see in the mirror, and so on. The brain completely sort of
attacks them.
So I think it's just it's like, clinical practice I think is valuable. It might not be randomized controlled trials, but if you can tweak something safely, and it's got to be safe, I don't completely go off piece. It's all within sort of the guidance of what we can prescribe safely and what we know we can prescribe. But I think my point is, it's so nuanced, women's health. Like, it's not something that a GP can do in 10 minutes well.
Yeah. No. And you're staying open and curious to, to outside of maybe a mainstream way of thinking, and that is exactly, how we operate. And it helps you to see things that other people might miss. It stops people being missed sometimes, or it opens up these options for so many different people. And I could talk to you forever, I think, about hormones and this neurodivergent body, this neurodivergent brain, and the relationship, because the models that we've got right now, and for me, I find them very difficult, the medical model of mental health, because of the restrictions around it and lack of curiosity. And I know research is going on and there's emerging evidence, but it's still kind of within these boundaries. And I think sometimes it does take people like yourself, like ourselves, to almost take that risk to say something outside of the mainstream that is emerging evidence, rather than, completely agreed by the scientific community. To actually make change, and it's hard to do that, but certainly in our work and in like my kind of own redesigning of some of my training, again within the boundaries, but if I ignored some of what I see, I couldn't live with that. I couldn't live with the very solid experience of seeing people time and time again go through adolescence, pregnancy and menopause, and have complete changes and like a more exaggerated experience of their neurodivergence. It's undeniable for me because I see it.
I think that's the thing, once you've seen it, you can't unsee it. So I've got lots of colleagues who will say, you can just tell, can't you? They're dubious, they're not sure, they think perhaps I'm grifting or whatever. I mean, I get about 90p off a book, so I don't think that's the case. But
it's the glaze, isn't it? When you
the side eye.
My Porsche's on hold.
She's menopausal.
Grifting. But it's not about that. When you've seen it and you can't unsee it, I can't carry on practicing pretending I've not seen that. And I always say I've been a GP trainer for over 10 years, and so I've had a lot of GP trainees come through with me, and I always say to them, evidence-based practice is really important. We have to be safe, we have to be solid, but also we have to be curious, because the absence of evidence is not evidence of absence.
Absolutely.
Just because we haven't got it written in a paper doesn't mean it's not right. And I think that's the problem with a lot of the things that happen to women. They don't feel believed, and often they're not believed. And another thing I always say to my trainees is, you don't have to have the answer, but you do have to believe them.
That's beautiful.
Just believe them, because that is so powerful. And I use that throughout my book. You are always believed here, and
I love that.
I truly, that's something that I will always say to my trainees, because I think it's, women, the biggest thing I hear from women is, I just felt like I wasn't believed.
You come away so disheartened, don't you?
I've been that woman, and it makes you feel so rubbish.
We've all been that.
That woman. I think we've all been that woman.
And then you're searching again, aren't you, for the answers, and
you start to almost like, because I'm obviously a doctor, and I'd been a doctor for many years, and I went to my GP for HRT, and it wasn't like a knee-jerk reaction. I thought about this for a long time. I doubted myself. I thought, I'm just imagining it. It's not right. I'd probably just like sleep in my I changed my duvet, make it light. You know, it's not. You do all these. The thing is, women, we do all these things. We don't just go, right, let's just run and ask for help.
Yeah.
We've done everything
we
before,
try everything.
haven't we?
And then I got told, oh no, you're too young. You can't possibly be in perimenopause. You're far too young. And do you know what I did? I went home and I thought, yeah, I'm too young. I'm just imagining it. I'm just going to have to get on with it. And I just pushed through for another 6 months. And I just got progressively more and more disabled, particularly brain-wise. And then my husband said to me, you know, what's the alternative? He said, you're going to have some HRT. What is the alternative here? Like, you're literally going to have to give up work or get some treatment because you cannot function like this. And I went privately, and fortunately I was able to do that, which a lot of women aren't, which makes me mad as well. And I went private, I got HRT, and within 2-4 weeks I wasn't 100%, but I knew I was on the right lines. I knew that I wasn't imagining it, hadn't made it up, hadn't tricked myself into thinking I was in perimenopause. I wasn't jumping on a bandwagon, I wasn't trying to be trendy. I knew that the estrogen was fixing me. That's, you know, that was it then. I sort of was, I felt like I could hold my head up high and say I'm right. But until that point, I was massively doubting. I had the anxiety, you know, what if I go on estrogen and then something happens and I didn't really need it, and it affects my children. But the guilt's awful.
I had a very similar story, but my first sign of perimenopause was a return of an OCD type experience. So it just went straight to my intrusive thoughts and intrusive images, and, you know, something I specialise in, but nothing worked for me until I had my hormonal treatment. And I understood OCD really, really well, so I had a level of protection there, but it was still very present. And when I had my hormone treatment, it completely died down. And that's my story. And I know that won't be, you know, everyone has a different. This is what we're talking about, the nuance of everything in terms of women's health. But I didn't recognise that as perimenopause because I'd never heard of that link between a change in, like, your intrusive thoughts. And
few people now have said to me, what is this perimenopause? Why are we suddenly talking about perimenopause? Like, surely, because when I started as a GP, which I know was a long time ago now, but even up until sort of 5-7 years ago, we only really saw women in menopause who'd stopped their periods, who were having the classic hots. We used to ask, have you got hot sweats? How's your mood? Have your period stopped? Okay, right. At the last resort, we'll give them HRT. But actually, when I think back through my practice, my career, I saw so many women in perimenopause in their 40s. They came in, they had aches and pains, they had mood changes, they had memory changes, they had palpitations. And what did we do? We sent them to the cardiologist, and they had loads of investigations, and it came back they were normal, and we said, oh, you're just anxious. You know, we sent them out on antidepressants because we thought they were depressed. We thought, you know, empty nest syndrome, oh, your children have left home, maybe it's that. What the hell? Like, you know, and I pull my hands up and say that I did that too, because I didn't know any better. I didn't know that this period of time in the run-up to menopause, where your hormones are really fluctuating, can actually be more difficult for women than the actual menopause part itself. And, you know, things move on, don't they, with time, thankfully. But I can think back to lots of women. It's definitely not new. We've just got a voice for it now and a place to raise it.
I heard you say that about the perimenopause. It gave me a lot of hope. Like, please say the next stage is an improvement.
I think we're all hoping that. maybe I'll rejig that when I get there.
And can I come back to that question of like young girls, neurodivergent young girls and periods? Like, have you got anything that you could say to that might be helpful?
I think at the minute, whilst we're still developing our nuances and our information on this, they're going to have a difficult time still in this pipeline, because I think what we need to do is empower them to believe, to stand up for themselves and to not be fobbed off and to not be told it's normal, it's just part of being a woman. You know, it's what happens, because it shouldn't. It's not. And I think that's the biggest thing we can do for our young young ladies coming up behind us.
thank
I
you.
totally agree with that.
Yeah.
And it's not that easy, is it? But that's partly why we created this Voice is Mine. It's about growing full size. And we want to do this collectively with people, because it's so hard to do it on your own. Again, that lone warrior against the system is a hard position to be in. But I think, you know, when you can say, well, I've just read Dr. Helen's book, and actually she says something very different.
Although somebody did tell me they bought a copy for their GP and he refused to take it.
No.
Oh, wow.
I would have signed it
That
for
says
him as
it
well.
all,
That's 90 pence
brilliant.
gone.
I just leave mine lying around. My husband walks past it one day, direct him to certain pages. But but that says a lot, doesn't it? Refusing to read it and to look
You
at
know,
it.
I've had many more that have messaged me and said, you know, I bought your book, I'm really interested. It's changed how I view the women that I'm seeing. You know, so we've got to look at the positives as well.
Yeah, there's some hope, isn't there?
It's definitely. I definitely feel more hope since it's come out, and I've had sort of more conversations that have been positive from the medical community.
That's lovely to hear.
It's fantastic work.
It is. So Helen, we're coming to a close, sadly. And we've been asking all our guests to bring in an object, something that is something grounding for them, so that our listeners, you know, see that us as professionals, we also need things that are grounding. We're all human. So I wondered, what did you brought in today?
Yeah, so I've not brought the actual thing. I've brought a picture of it because it would have been a bit weird. The bag's not that big on the train. But I've got a picture, and this picture is up in my consultation room and has been since the day I qualified. And it's up in my house as well. And it's a picture of my mum. My mum was a midwife. She died when I was at medical school. And never got to see me graduate or anything, but she was a strong advocate for women and women's rights.
Wow.
And sort of, I think that's probably like, you know, what was bred into me. So this picture is of her with a random baby, who actually somebody did contact me and say they were that baby, because they'd seen the picture on something.
In her midwife.
In her midwifery apron. Yeah, of course. So when I'm having a hard day...
That's gorgeous. We can show the camera.
Yeah,
if that's all right.
Is that okay? Yeah. Wow.
When I'm having a hard day, I just look at that picture and think, you know, like, we can do this.
Oh, I absolutely love that. I don't think I could love you anymore. But I do now after this.
Not ready to let you go.
Well, you have to put the fan on a bit higher if you're not letting me go.
Yes, it's very hot, listeners.
We're
in the heat wave in London.
They did tell me I'd put an extra HRT patch on. No, don't do that. Don't do that. That's not medical advice. Not medical advice.
Well, listen, it has been so fantastic to meet you in real life, to talk with you, and just thank you so much for being here and doing what you're doing.
The work you're doing.
Thank
you. Thanks so much for yourselves as well. And I think, you know, we just need to keep going, don't we? And
keep going, keep supporting each other, keep lifting our voices, and keep lifting each other.
Thank you.